Hi, I'm Tammy Brady, and I'm a peds nephrologist here at Johns Hopkins, and I'm going to show you how to use your ambulatory blood pressure monitor device. This is Alexis Brady, who's going to help us demonstrate. So this is the device, and the first thing that you really want to make sure you do is to put the cuff on properly. And fortunately, this is relatively simple. There's this sleeve with an arrow, and the arrow is pointing to where the crease in your elbow is, and that is where you're going to want to position the cuff. Okay, and you want to have it a couple of finger breadths above where that crease is, and then you want to make sure that the cuff goes on snugly, like so. So you don't really want more than two fingers underneath. Okay, and then in order to get it situated, you want to try your best to loop it around the neck, and then ultimately we'll have the device placed in a pocket, or as I'll show you later, you'll be able to put it on a belt buckle. Make sure that this, like I said, is snug, and typically you want to put it on the non-dominant arm. Okay, so then to turn it on, you click the button. And then generally within, as you'll see here, soon after clicking the button, it's going to start to take a blood pressure measurement. The best thing to do while it's taking a blood pressure measurement is to just relax your arm, right? So you're going to be wearing this, you're going to be walking around all day, and every 20 minutes during the day, and every 30 minutes while you're asleep, it's going to take a measurement. And so just kind of stop what you're doing, relax your arm, let the device take the measurement, and then carry out your day. If there's some movement, or if there's trouble with the device getting a signal, it may, as it's deflating the cuff, it may reinflate and then deflate and reinflate and then deflate. And if that happens, again, it's just really trying to rest your arm as best you can. Sometimes the device will attempt to take a measurement, and for whatever reason there's an error message. When that happens, the device will try to take a blood pressure. So this measurement was just completed. It'll try to take a measurement several times, up to 3 times. And if it's unsuccessful after the 3rd attempt, it will stop. And then 20 minutes after that, it'll try again. And so sometimes what you'll see, depending on how the device is set up, you may see the blood pressure and you may see a number. The number refers to how many blood pressures it's actually taken. And by the end of the 24-hour period, you should expect to have 90 to 120 measurements. So once you've had the device set up in this way, if it's not already placed in one of these carrying cases, I would make sure that it's in that. That helps protect the device. And then this carrying case has, like I said, a little area for you to put on your belt buckle. So you can attach it to a belt buckle, a purse, or you can just stick it in, into your pocket. There are 2 other buttons here that you'll notice. This button is the day-night button, and so as you go to bed, to go to sleep for the night, you can push the button, and when you wake up in the morning, you can push the button again. It helps us know when you're actually sleeping. If you forget, it's fine. We're also going to ask you information about when you went to bed and when you woke up. And then sometimes you may experience symptoms, dizziness, headache, what have you, and you can push this button to indicate when those symptoms occurred. And again, don't worry if you forget to do that. We'll also ask you that information. Now, the other thing that's important to remember is that this device really should not get wet at all. So when you're showering, or if you're going for a swim, you want to make sure you take the whole device off and the cuff off, and you want to turn the device off. And so to turn the device off, you hold this down, and then it's off. And then all you would do is you would just put the cuff back on the way we just described, and then you would turn it back on. And typically, like I said, when you push the button on, it's going to take another measurement. Other things, you can try to help your patient to keep it underneath their clothes. So either they can loop it under a shirt that they're already wearing, or we can do it like this. And again, if there's a pocket, you can put it in the pocket. And then I think those are really the big things. And so I think any questions that come up while you're using this device, it's important to communicate with your primary care provider and they can help you troubleshoot further. But that's it.